Hello and thank you for joining us on today's headline on Hillcrest TV. I am Isioma Omefe. In a recent press briefing, Nigeria's Coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, highlighted the urgent need to tackle the growing threat of tuberculosis in the country. According to Pate, key factors driving the rise of TB include undernutrition, HIV, diabetes, smoking, and alcohol use. The most vulnerable group, he noted, are Nigerians aged 15 to 44 years. Speaking at the ministerial press briefing to mark World TB Day, Pate emphasized the theme of this year's observance, Yes, We Can End TB, Commit, Invest, Deliver. Was the slogan, We Fit Duam. Represented by the Director of Port Health Services, Dr. Nsi Akwan, the Minister, shared concerning statistics. In 2023, over 71,000 Nigerians lost their lives to TB, and alarmingly, only 1 in 4 Nigerians have an accurate understanding of the disease based on the 2017 survey. Pate pointed out that Nigeria is one of the 10 countries facing the triple burden of TB, drug-resistant TB, and HIV-associated TB. But despite these challenges, the government remains committed to eradicating TB. Efforts to combat TB are already underway. The Federal Ministry of Health, alongside key partners, has expanded rapid molecular testing for TB and opened more treatment centers. Routine TB screenings are now available in tertiary health facilities, secondary hospitals, and over 500 high-burden primary health centers. These steps have resulted in increased TB notifications, a positive sign of progress. In addition, mobile digital X-ray units equipped with artificial intelligence are being used to improve TB screening, especially among vulnerable populations. Currently, over 400 of these advanced mobile units are operating across Nigeria, significantly boosting the sensitivity of TB detection. Further support for TB control comes from a successful $50 million bond raised for the cause, with half of the funding coming from the private sector. However, the financial burden on TB patients remains a significant challenge, with 71% incurring catastrophic costs while seeking care. To address this, the government launched the Nigeria One Impact-Free Skill Acquisition Program in Lagos. This initiative aims to provide women and individuals affected by TB with essential skills and start-up resources to help them recover and enhance their economic stability. Community engagement is also central to the strategy, with efforts to reduce stigma and encourage participation in TB prevention and care programs. According to Ms. Uzoma Nwofo from the Institute of Human Virology Nigeria, TB's persistence in the country is deeply linked to socio-economic factors like poverty, malnutrition, and overcrowding, and limited access to healthcare. The 2022 Multidimensional Poverty Index revealed that 63% of Nigerians live in poverty, contributing significantly to the spread of the disease. Mwafa also noted that the malnutrition weakens the immune system, making children particularly vulnerable to TB. She stressed that limited healthcare funding, with less than 5% of Nigeria's GDP allocated to healthcare, further complicates efforts to fight TB. At the World Health Organization, Dr. Walter Mulombo, represented by Maya Ngong, emphasized the need for increased domestic investment to sustain TB control efforts, particularly after the suspension of USAID funding. The WHO has pledged to continue supporting Nigeria's TB response through resource mobilization and strengthening the health system. Mulumbo also stressed the importance of continued efforts to stop the spread of TB and end the epidemic by 2035. The fight against TB in Nigeria is far from over, but with ongoing collaboration and commitment from the government, healthcare professionals, and the community, there is hope that together we can end the epidemic. That's all for now. Stay with us for more updates. I am Isioma Omefe.